Welcome everybody to Chronic Fatigue and Fibromyalgia Update. I am Dr. Richard Podell, and today we're talking about practical points for how a person with fibromyalgia or chronic fatigue can exercise more effectively and safely and with a sense of achievement. And our guest today, our expert, is Dr. Kim Jones. Dr. Jones is an associate professor at the Oregon Health and Science University. She is one of the leading experts in all of fibromyalgia, but has made particularly intense research into exercise, has lectured to many groups, has taught many patients, and we're delighted to have Dr. Jones telling us about the specific advice she has to give to patients. So, Dr. Jones, we're back on the air.
Thank you. My next piece of advice may seem a little counterintuitive. Normally you go to your healthcare provider and they tell you to do more aerobic exercise, do more strength training, do more flexibility, work on your balance. But this slide really says maybe you should rest. And by that we mean balance exercise with rest. People with fibromyalgia, as you know, don't sleep very well, often awake feeling very unrefreshed, and need to have some rest time during the day in order to exercise at an optimal level. So we think that balancing exercise with rest is very important. This may even include talking to your healthcare provider about things you can do to sleep better at night, whether it's certain advice for sleep or whether it's medications for sleep, but you need to be rested in order to exercise well. The next piece of advice that I would have is to really think about pain postures. And this is something that we all naturally do as soon as we're in pain. We pull our shoulders up and toward our ears and maybe lean our chest forward. It's a natural protective mechanism when we have pain. But when we have chronic pain like fibromyalgia and chronic fatigue syndrome, we've got to consciously learn to get our chin back, lift the crown of our head, relax our shoulders downward, and really have deeper breathing. If we could even stretch the anterior chest muscles and strengthen the upper back, that would promote optimal alignment. Because when we're not in optimal alignment, we have pain signals going from the periphery to the brain and spinal cord on a regular basis. So even when we're not trying to exercise, we're creating more pain than we need. So during exercise, we need to reverse pain postures so that we can remember them when we're not exercising and stay in those more neutral positions.
Now, that's an interesting point, because I find that many people really don't realize what their postures are, and I sure don't. But I know in my fibromyalgia practice, probably 90% of the people I see have a typical pattern is that their chin is held forward, their neck is held forward, their tongue may be thrusted a little forward, and that this creates a strain in the whole posterior neck muscles. Is a physical therapist helpful for people to get to realize what they're doing? I mean, what a lot of patients say is, I can't change my habit because I don't realize I'm doing it.
So physical therapists are just like doctors and nurse practitioners. If they have a lot of expertise in fibromyalgia, they are your best partner, and they will have all sorts of tips to help you work out pain postures and help you get into a good exercise routine. You just need to find one that has expertise in chronic pain, and often these are physical therapists that work on a spine team, for example. You may or may not find as much help from a physical therapist that works with, 18 or 20-year-olds in a sports medicine clinic, for example. That's a different specialty of physical therapy.
So the orthopedists and the neurosurgeons who work on spine, their physical therapists will probably be fairly skilled at this.
They are usually very skilled at this, and they're also very skilled at helping you realize how to modify what it is you already like to do into something that you can do now with fibromyalgia. So you don't have to do the exercise routine that I'm prescribing. They can help you think about activities you like to do before you had fibromyalgia, and then use these principles such as minimizing eccentric muscle work and keeping muscle near the midline of the body to work on many other kinds of activities as well. So yes, seeing a skilled physical therapist for multiple visits, we usually do 10 to 12 visits at our clinic, is very helpful.
Good, good. So your next advice.
All right, so my next piece of advice after we've gotten our shoulders down and our chin back is to actually have a part of our exercise program that is practicing expansive breathing and relaxation. And that might sound counterintuitive when we're trying to get more fit, but actually there's some good evidence about the autonomic nervous system in fibromyalgia being a little bit on edge. And if we can do some deep breathing and particularly some prolonged exhales, that we may actually be able to reset part of that and sort of calm down our nervous system. So we put breathing in all of our exercises as a key component.
Now, how are they going to learn the breathing? Is that something, who teaches that?
Our exercise instructor teaches it, and there are certainly apps you can download onto your smartphone for breathing, and there's a number of devices that specialty labs have that are a biofeedback type device where you can watch your inhales and exhales, but we do it at Oregon with our exercise instructor.
Okay. Is there a website that people can go to learn this?
We can go to myalgia.com, which is also fibromyalgiainformation.org, and we have books and references there about deep breathing, expansive breathing, relaxation. We have exercise DVDs, including one on stretching and relaxation that has a guided imagery and relaxation section to it that's specifically made for people with fibromyalgia and was tested with funding from the National Institutes of Health.
So that's myalgia.com, myalgia.com.
Correct.
Okay, wonderful.
Another tip for people with fibromyalgia to exercise successfully is to seek out warm water options. Water naturally builds muscle resistance. Just as you move through the water, you build resistance. Buoyancy may also help reduce pain by acting on thermo and mechanoreceptors. In other words, there are temperature and touch receptors in our skin that transfer pain, and being in the water, particularly warm water, may minimize the effect of this. If you are going to be in a shallow water program like a water aerobics, I would encourage you to not spend a lot of time with your arms overhead, but do the underwater part a lot. If you're going to do a deep water aerobics program, I would encourage you not to put on ankle weights, for example. Just use your natural weight and your natural buoyancy, and you would wear a weighted belt as the rest of the class would, but having those extra weights on your ankles actually produces low back pain in a lot of people with fibromyalgia, and part of having fibromyalgia usually is having spine pain, so we want to minimize the amount of stress that we have on our spine. There's another danger about water, and that is that some people with fibromyalgia are hypermobile. In other words, their joints naturally move beyond the natural joint line. And we want to make sure that we don't overstretch our joints. So when you're fanning your arms in and out in a water aerobics class under the water, it's easy to have your elbow extend beyond its natural joint line. So you just have to be aware if you have this so that you can slightly contract your muscles and keep your joints in a neutral position. Another thing I would say about water exercise is that it's certainly not all created equally, and by water exercise I really mean moving in a certain way in the water as opposed to, say, doing the front crawl swimming in the water. That's overhead movement. It's highly eccentric. It's something that you could work on eventually, but I'm really talking about just using the water as a medium to get moving, and that may be enough for some people. If you've been a competitive swimmer in the past, certainly a physical therapist could help you work on those strokes in a way that would let you get to do something enjoyable like that. But for most people with fibromyalgia, I'm not encouraging you to get in and do multiple laps of overhead swimming.
Well, as a practical question, if you go into a pool and you're in a class and these people are a lot more vigorous than you are, and you're embarrassed to say anything about it, how do you get people who, to be able to accommodate to that? Are there classes, say, for people with arthritis? Where should one seek to go so that you can work at your pace and not at the pace of somebody who's much fitter?
Yeah, that's a great question, and that's why I don't tend to recommend classes like Zumba and beach bodies and various high-intensity aerobic classes that are really geared toward very young people with no injuries or chronic illnesses. The Arthritis Foundation does have classes that have been tested extensively and are at many facilities such as YMCAs, and any good exercise instructor is going to want to know what your limitations are. If you don't want to say it out loud in the front of the class when the instructor generally asks, you can go to our website, again, myalgia.com, and print off a list of what to tell your exercise instructor so they can help you modify your exercise prescription. If you're still uncomfortable after that point, having a spot nearer the back of the class is more comfortable to some people. But the important thing is that you're always going for your own personal best. And to me, your personal best is how can you get back in the water again 2 days from now? And if you're in a terrible pain flare, that's not going to happen.
Okay, that's good advice.
Okay, so let's take a break here and then come back and have some final points about how to optimize exercise with fibromyalgia.
Okay.